RCSI, in collaboration with the HSE National Doctors Training and Planning, provides educational courses for non-consultant hospital doctors, or NCHDs, through their Continuous Professional Development Support Scheme. The CPD Support Scheme offers a combination of in-person and online courses in technical and non-technical skills, including human factors, for the surgical specialties, emergency medicine, and others. This programme is constantly evolving, with new courses introduced each year, based on the educational and training needs to support surgeons, emergency medicine physicians, and other medical professions' needs.
Hello, you are very welcome to attend the launch of the CPD brochure for 23-24. I would like to introduce myself. My name is Paula Mansell and I'm the manager of the Professional Education and Learning team. At today's session, you're going to hear from various speakers who deliver courses on this programme. They will give you a closer insight into some of the courses which we have on offer this year. But for those of you new to rolling in the CPD scheme, just to give you a bit of information on what the scheme is about. This scheme is funded by HSE and DTP to facilitate NCHDs who are not on a training post, to help maintain and enhance their clinical knowledge and skills in order to maintain their professional development, professional competency in line with the medical council requirements. So just to be clear, the CPD scheme and the professional competence scheme are two different schemes. This is just a high-level overview between PCS and CPD. CPD-SS is free to enrol and offers 3 free courses, while PCS is mandatory to register and a fee is applicable. This year's programme consists of over 120 courses in technical skills, emergency medicine, personal development, quality improvement, human factors, and IT workshops. Courses will be delivered face-to-face and online. We're also delivering a number of our face-to-face courses regionally to make them more accessible. Not only that, we have a number of self-paced online courses which you can do in your own time and schedule. Now, our CPD Hub. In 2022, we launched the CPD Hub. Once enrolled in CPD, you will receive an email in order to set up your CPD Hub account. Once you've set this up, you can book your CPD courses via the RCSI website and use your unique voucher code when booking your courses. The benefit to this platform is it allows you to update your personal data, view the status of your courses, receive reminders for your courses, and download certificates of attendances receipts for courses. The surgical logbook. Since 2023, the RCSI logbook was made available free of charge and optional to use for NCHDs enrolled in CPD. A number of benefits to this is either the same electronic logbook as trainers on our core training programme. Consultant trainers, supervisors are already familiar with this logbook. Affiliated membership. Last year, all NCHDs enrolled in CPD became affiliated RCSI members. Based on positive feedback, we plan on doing the same this year. The portal provides a number of excellent resources, one of which includes helping to prepare for the MRCS exam. Thank you.
Hi, my name is Leonie Heskin. I'm the Simulation Technology Development Lead for Postgraduate Surgery in the Royal College of Surgeons in Ireland. I also have the pleasure of leading the Surgical Technical Skills courses for the Continuous Professional Development Support Scheme. It's been a pleasure to be part of this support scheme since its inauguration in 2011, and it is also a pleasure to teach and arrange courses for the participants of the CPD-SS scheme, as they're so enthusiastic and an absolute pleasure to teach. The very first course we developed in 2012 was a basic surgical skills course, and this continues to this day, where we teach basic knot tying and also suturing, and closing of complex wounds. However, we've expanded our course offerings since that time, and our courses do change from year to year. We introduce 3 new courses every year, and the type of specialties we cater for also changes. However, some of the core classes have remained due to the high demand, and one of them is the suturing skills and wound closure. That is an improved version of the original. We've also introduced minor operations workshop, and this is very like if you're running a minor operating theatre yourself in the hospital. So minor procedures such as toenail removal, removal of pigmented lesion, removal of sebaceous cyst, that kind of minor procedures occurs during this workshop. And the next course up in general surgery is an intermediate general surgical course. Within this course, you will learn how to repair an opening inguinal hernia, also repair a bowel anastomosis, and also form different types of stomas. So for these courses, we try to cater for the more junior trainees and also the more senior registrars in the hospitals. We introduced a microsurgical course there last year, and you could call this a more advanced version of our basic surgical skills course. And it incorporated into this course, you will explore a limb and repair tendons, muscles, nerves, and therefore practice your suturing skills, but in a more advanced fashion. For our endoscopy courses, we've also created a series of 3 courses that increase in difficulty. So the basic endoscopy course, you will learn how to manage an endoscope, be it a gastroscope or a colonoscope. Also during this course, we look at sedation of the patient, bowel preparation, and those themes. One step up then is our intermediate endoscopy polypectomy workshop. This is quite an important course and is ideal for learning how to manage polyps and also the clinical skills to remove them with various types of snares. One step up from that again for more advanced surgeons, we have an advanced upper GI emergency management course. This is a combination of endoscopy and laparoscopy, but it concentrates more on emergency management of hemorrhage of the upper and GI tract. Our laparoscopy courses also range in difficulty. So our basic laparoscopic course is a very good course for learning basic skills, determining your depth of perception, your fine motor skills when using laparoscopic instruments. The second half of that day, you will do a laparoscopic cholecystectomy on an animal model. So there's a lot of practice of your skills throughout the day. The advanced laparoscopic suturing course is a step up from that. And the suturing does occur on animal models, and it also incorporates procedures such as Graham's patch. Our advanced general surgical skills course is a brand new course that we introduced last year, and I'm delighted to say that we're using full pigs for this course. Again, you will learn your laparoscopic procedures earlier in the day, and then in the afternoon we do convert from endoscopic to open procedures, so you get that practice that may not happen that often in the hospital settings. But it's not all about general surgery. We're very conscious that all specialties need to be catered for in the CPD-SS program. And this does vary from year to year. So for example, last year we had a bathybiliary course and a cardiothoracic course. This year we've introduced other new ones. In fact, we introduced 3 new courses every year. And a lot of the courses that we do provide, be it for general surgery or any of the other specialties, are really based on what the participants ask for. So I'm quite particular to get that feedback from everyone that comes in the door to our courses. And at the end of our feedback form, where we ask how the participant would like to improve the course, we also ask them what kind of courses they would like us to create for the following year, and we do listen to those suggestions, and a lot of these courses are based on the requirements of the participants on the CPD-SS programme. So, for example, for orthopedics, we have a casting and fracture management course, and the fracture management course, we do use synthetic bones, as you can see in the image in this slide, but also we use animal fractured bones that are covered with soft tissues, which gives the realism of going through skin and muscle to get to the fracture. Our basic skills in urology is a shared course with our core trainees, and during this course we look at the management of an enlarged prostate through a TURP. We do circumcision, we manage a hydrocele repair, so it's quite an interesting course. The head and neck trauma management course is really a combination of neurosurgery and ear, nose and throat, or ENT surgery, and is all about immediate management of trauma. Our ENT skills course for general surgeons is a basic course that will allow you to manage most presentations into your ED department, such as the management of an epistaxis. Our vascular surgery course actually would be of interest to vascular, but also surgeons in plastics or in general surgery, as it is a basic course that goes through the different management of hemorrhage control, but also end-to-end and into-side vascular anastomosis and those type of procedures. The microvascular surgery course I have spoken about already. And the management of the ICU patient came from my days as a plastic surgeon, where it was necessary to work very closely with the intensivist who was looking after your patient after a surgical procedure. And this course gives great insights into that. So during the process of developing the CPD-SS programme and the courses, we have often developed models to enable certain procedures to be taught, and this is achieved by cooperation between faculty and our fantastic technical team who work with us to develop models. Now, this could be a synthetic model or an animal model, and as I said earlier, we do try and incorporate virtual reality where we can. So thank you for listening, and I'm really looking forward to seeing you come to our courses in the coming year and for many years to come. Thank you very much.
My name is Nigel Salter. I work as an emergency medicine consultant in St. Vincent's University Hospital in Dublin, and I joined the Irish Committee of Emergency Medicine Training in around 2018 as the lead for the CPD support scheme courses in emergency medicine. So we have about 4 different categories of courses that we offer, and this year we've quite a daunting 37 days of courses lined up for you. So the first category is our full day courses, and this includes our very popular level 1 point of care ultrasound course under the leadership of Dr. Gareth Fitzpatrick, which is offered on site in RCSI. We have an emergency toxicology course in collaboration with the National Poisons Information Centre. We have major trauma skills as well as minor trauma skills, a procedural sedation and analgesia course, which is held in the ASSERT Centre in UCC in collaboration with our colleagues in CUH, rhesus simulation, a mental health emergencies day, as well as geriatric emergency medicine and pediatric emergencies. Now, our days obviously cover quite a variety of different topics. In general, the format follows a roughly 9:30 start, and we generally kick off with a didactic session for the early part of the morning, and that's generally followed by workshops for the latter part of the morning. And in the afternoon, we focus more on simulation, case-based scenarios, and interactive feedback and discussion. So here's an excerpt of the type of thing that we cover in our major trauma day, our major trauma skills. So the excellent simulation facilities, as well as our technicians on site in the college, offer us a unique opportunity for this type of immersive learning in a safe environment. So we get an opportunity compared to other courses to be able to engage in procedures that are high acuity and low occurrence, like thoracotomies or lateral canthotomies or even resuscitative hysterotomies. And these are followed by structured debriefing and interactive discussions with expert faculty following each scenario. So in addition to the full day courses, we offer a number of 3-day certificates. The first of which is our pre-hospital care cert. And this is led by Dr. David Menzies. There's 3 days that cover pre-hospital medical presentations, including things like collapses, cardiac arrests, chest pain, shortness of breath, and how you would manage these in the unique environment of not having your usual hospital resources readily to hand. The second day is a trauma-based day, and we see quite unique scenes in RCSI of mannequins at the bottom of flights of stairs having supposedly fallen down with head injuries, spinal injuries, musculoskeletal injuries, and how to immobilize and splint these injuries. And the third day then is a little bit of a potpourri of topics incorporating mental health, obstetric and pediatric presentations, as well as major incident management in a pre-hospital setting. We also offer a point of care ultrasound certificate in collaboration with the Mater Hospital's Pillar Centre and the expert tutelage of Dr. Cian McDermott and Dr. Tomas Breslin there. So the 3 days give you a more extended opportunity to practice the skills required for point of care ultrasound with expert faculty tuition. It covers the basic concepts of EFAST, as well as thoracic ultrasound and some more specialized types of ultrasound, including scanning gallbladders and then using ultrasound in the context of procedures. Now, we also have a variety of online courses, including our medical emergencies courses, and this breaks down acute medicine to 8 broad topics. And this year we're recording a set of 8 new modules in addition to the previous 8 modules for you to be able to select from. The ECG Interpretation Day is an online on-demand course which thoroughly covers all of the aspects of ECG interpretation required in an emergency department. And we also have a full day online course in emergency radiology, which is presented as a set of interactive workshops on Zoom with 2 radiologists of experience of working in emergency departments. Now, we are continuing this year to provide ACLS training with First Aid for Life that's held in the Midlands Regional Hospital in Tullamore. And at the end of this, you will be able to attain the AHA's ACLS provider certificate if you're successful. And this year, we're also going to be introducing, in collaboration with Critical Care Training, the APLS course, Advanced Pediatric Life Support. And this will build on the skills for those who complete the Pediatric Emergencies Day over the 2 days of face-to-face lectures, skill stations and simulation scenarios, as well as demonstrations in management of the seriously ill or injured child. And again, will allow you to have an internationally accredited certificate from ALSG. And finally, we are delighted to be collaborating with the Defence Forces in the Curragh in County Kildare, where we're going to be holding for the first time the Advanced Hazmat Life Support Group course, which is the hazmat stands for hazardous materials. So this course builds on the knowledge of the emergency toxicology courses, and it allows you to learn a systematic approach for medically managing chemical incidents, as well as nerve agents, biological agents, and radiological events also. So that's a little whistle-stop tour of our courses for emergency medicine training, and we look forward to seeing you over the course of the next year.
My name is Eva Doherty, and I am a clinical psychologist, and I'm director of the Human Factors in Patient Safety Training programs in RCSI. And I'm really pleased to have this opportunity to talk to you for a couple of minutes about the programs we offer on what is called the CPD-SS. So that is the Continuous Professional Development Support Scheme. So we offer two main programs, if you like. One is our Train the Trainer courses, and they are very popular, and they focus on the skills of giving feedback. And we use high fidelity simulation to teach these principles. And if you come to this course, you will learn how to give feedback in all kinds of situations. The skills that we teach, it's a particular model, it's a particular clever way of giving feedback, which is very effective. And it can be used, just with conversations with your colleagues. It can be used for teaching juniors. It can be used for giving feedback in lots and lots of different scenarios. Just the Train the Trainer. The other really exciting program that we offer is a certificate program. And that's a 3-day program. So you have to come to all 3 days. The first day will focus on your clinical communication skills with your patients and their families. And we will teach you all the principles of effective communication skills. These are skills which, they're not really intuitive. They're not maybe the ones that you might have heard of before, but they are evidence-based communication skills that not only lead to improved conversations and better, safer care, but will also contribute to reducing your own burnout and stress levels. So that's the first day. The second day then is a team training day, and that day uses high fidelity simulation and focuses very much on the skills of effective teamwork. And we will put you through your paces, get you to manage crisis scenarios in the high fidelity simulation environment, so a mock emergency department, and we will debrief the skills, and it's done in a way that is really supportive and very it promotes great learning. And then the third day of that certificate program is also a Train the Trainer day, and that is the same as our standalone Train the Trainer days, and again focusing on the skills of giving effective feedback. So I look forward to seeing you at our courses, and look forward to meeting you and getting to know you.
Applications for our CPD support scheme will close on Friday the 29th of September. For more information, please visit www.rcsi.com/CPD-SS or scan the QR code. If you have any queries, please email cpdss@rcsi.ie.